Acquired immunodeficiency syndrome, or commonly known as AIDS, it's a chronic, potentially life-threatening condition caused by the human immunodeficiency virus HIV. According to the UNAIDS, there are 2.4 million living with HIV in India, and 70,000 of these are children. That's a huge number. This means that we still have parent-to-child transmission despite having advanced treatments and medicines. According to a data for 2022-23, where there were 15 lakh women that were tested, out of them 421 pregnant women tested positive for AIDS, indicating a positivity rate of 0.03%. That's very high. We at Medicircle are conducting the AIDS awareness series to educate people about AIDS and its preventative measures. There are so many questions that the patients need to know. And yes, through our channel, they would be able to get answers to the questions that they want to ask. And these answers are being given by eminent, senior, and experienced doctors who have been treating AIDS and HIV patients for quite long. Hello, this is Smita Kumar and you're watching Medicircle. Today in our AIDS awareness series, we have Dr. Shekhar Benade with us. Dr. Shekhar is an Ayurveda physician and sexologist in Pune, and he's currently practicing at Normal Life Clinic. For the past 23 years, he has worked as an Ayurveda physician. Hi and welcome to Medicircle AIDS awareness series, Dr. Shekhar.
Hello.
So, Dr. Shekhar, my first question is, what are the symptoms of AIDS and HIV?
Okay, first we have to understand what is HIV and AIDS. HIV means it's human immunodeficiency virus, which causes acquired immunodeficiency syndrome. We can make two groups, early symptoms of group and as the disease progresses, the latter group. In early symptoms, you may get fever, fatigueness, muscle aches, headache, sore throat, and swollen lymph nodes. Sometimes skin rash, night sweats, mouth sores. So these are early signs of HIV infections. Then later, as the disease progresses, your immunity becomes weak, and at that time you may get various kinds of infections such as pneumonia, tuberculosis, candidiasis, and that also causes weight loss, anemia, and some neurological problems, some psychological problems. These are the main signs and symptoms of HIV infections.
Doctor, can you tell us that can AIDS be transmitted through blood transfusions?
Yes, HIV can be transmitted through blood transfusion. Blood transfusions have been one of the main ways that HIV has been transmitted in the past years, but risk of this transfusion has been greatly reduced in recent years due to implementation of blood screening procedures. In many countries, all the donated blood is now screened for the presence of HIV and other infectious diseases which prevented these kind of infections.
So, Dr. Shekhar, tell us, how can injecting drug users reduce their risk of contracting HIV?
There are many ways to do this, but I can say every time we must use new and sterile needle and syringes, and also avoiding reusing, sharing any injection equipment to reduce the risk of HIV transmissions. Also, we have to use sterile water and clean the injection site every time. Mixing of combinations, we have to avoid. Repeated HIV testing is also recommended to reduce the risk of contracting HIV.
Doctor, in your view, is it safe for two people living with HIV to engage in unprotected sex exclusively with each other?
HIV can mutate and change over the time, which can result in development of different strains of viruses. When two people, if they are having unprotected sex, then they can alter the ART treatments, as ART can lower the amount of virus in the blood, but it does not eliminate virus completely.
Dr. Shekhar, kindly tell our audience what is post-exposure preventative treatment.
Post-exposure prophylaxis treatment is taken after exposure to HIV in order to reduce risk of infection. It is not guaranteed prevention method, but it can significantly lower the risk of HIV transmission. PEP is typically recommended to the people who have exposure to HIV, such as needle stick injury or unprotected sexual contact with HIV person. It is most effective when it is started within 7 to 2 hours of exposure, but can still be effective up to 7 to 2 hours exposures. If you think you may have been exposed to HIV, it is important to seek medical attention immediately or to discuss with medical provider.
And this is the most important question that we always want to ask a doctor is, can AIDS or HIV be fully curable? Is it fully curable? If it is yes, what types of drugs can be given and what medication should be followed to treat HIV and AIDS fully?
No, currently there is no cure for AIDS or HIV. However, with proper medical care and antiretroviral therapy, people with HIV can live long and healthy lives. This ART involves combination of many drugs. The drugs works to slow down replication of viruses in the body, allowing immune system to recover and reducing the risk of AIDS-related illnesses. There are many drugs such as NRTIs, NNRTIs, and protease inhibitors, which are included in ART. There is also one important thing I can tell you. In addition to this ART treatment, it is also important for people with HIV to adopt healthy lifestyle and practices such as eating well-balanced diet and getting regular exercise, and also to avoid risky behaviors that can lead to transmission of HIV. It is very important here to get regular medical care and monitoring for long-term health and well-being of people with HIV.
Thank you so much, Dr. Shekhar, for coming to Medicircle and sharing your insightful views about AIDS. I hope our audience would definitely find the information shared by you relevant. Thank you once again for joining us.
Yeah, thank you. Thank you for inviting me on your this channel.